Common questions in job interview for nurses. Preparing for a nursing job interview is not only about knowing medical terms or clinical procedures. Employers want to understand how you care for patients, communicate with families, handle pressure, follow safety rules, and work with a healthcare team. Nursing interviews often include questions about patient care, difficult situations, teamwork, time management, ethics, and your motivation for choosing nursing. The best answers should show compassion, professionalism, confidence, and real understanding of the nursing role. In this guide, you will find 15 common nursing interview questions with strong sample answers to help you prepare effectively. 1. Why do you want to work as a nurse? I want to work as a nurse because I genuinely care about helping people during vulnerable moments in their lives. Nursing allows me to combine clinical knowledge with compassion, communication, and problem solving. I enjoy being part of a healthcare team where every action can improve a patient's comfort, safety, and recovery. For me, nursing is not just a job. It is a responsibility to support patients physically and emotionally while providing safe, respectful, and professional care every day. 2. Tell me about yourself. I am a dedicated and patient-focused nursing professional with a strong interest in providing safe, compassionate, and organized care. I have developed skills in patient assessment, communication, documentation, infection control, and teamwork. I try to stay calm under pressure and always focus on patient safety first. I enjoy learning from experienced healthcare professionals and improving my clinical judgment. My goal is to contribute positively. 3. What are your strengths as a nurse? One of my strongest qualities as a nurse is my ability to stay calm and focused in stressful situations. I understand that healthcare environments can change quickly, so I try to prioritize tasks, communicate clearly, and respond professionally. I am also compassionate with patients and careful with documentation and safety procedures. I listen closely to patients' concerns and work well with doctors, nurses, and support staff. These strengths help me provide reliable care and build trust with patients. 4. How do you handle stressful situations? When I face a stressful situation, I first stay calm and focus on what needs immediate attention. In nursing, stress can affect decision-making, so I try to assess the situation, prioritize patient safety, and follow proper procedures. I also communicate clearly with the healthcare team and ask for help when needed. After the situation is controlled, I reflect on what happened and what I can learn from it. This approach helps me remain professional and effective under pressure. 5. How would you handle a difficult patient? If I had a difficult patient, I would first remain calm, respectful, and patient. I would listen carefully to understand why they are upset, uncomfortable, or uncooperative. Many patients act difficult because they are in pain, scared, confused, or frustrated. I would explain things clearly, show empathy, and try to build trust. If the situation became unsafe or beyond my role, 6. How do you prioritize patient care? I prioritize patient care by focusing on urgency, safety, and clinical need. Patients with life-threatening symptoms, sudden changes in condition, severe pain, or high-risk situations must be addressed first. I also consider medication schedules, treatments, documentation, and communication with the healthcare team. I use assessment skills and follow hospital policies to decide what needs immediate action. Good prioritization helps prevent mistakes, reduces delays, and ensures that every patient. 7. How do you handle conflict with a coworker? If I have a conflict with a coworker, I try to handle it professionally and privately. I would listen to their point of view, explain my concerns calmly, and focus on the patient's best interest instead of personal feelings. Nursing requires teamwork, so unresolved conflict can affect patient care. If we cannot solve the issue respectfully, I would involve a charge nurse or supervisor. My goal is always to maintain a respectful workplace and safe patient care. 8. What would you do if you made a mistake? If I made a mistake, I would report it immediately according to hospital policy. Patient safety must always come first, so hiding a mistake is never acceptable. I would assess the patient, inform the appropriate nurse or provider, document accurately, and follow the required steps to correct the situation. Afterward, I would reflect on what caused the mistake and how to prevent it in the future. Accountability is very important in 9. How do you communicate with patients and families? I communicate with patients and families in a clear, respectful, and compassionate way. I avoid using confusing medical language and explain information in simple terms. I also listen carefully because families often have concerns, fears, or questions. When needed, I confirm understanding by asking if they need clarification. I always respect privacy and follow confidentiality rules. Good communication helps patients feel safer, improves cooperation. 10. How do you ensure patient safety? I ensure patient safety by following proper procedures, checking patient identification, maintaining infection control, documenting accurately, and communicating changes quickly. Before giving medication or treatment, I verify the patient, medication, dose, route, and time. I also pay attention to fall risks, allergies, vital signs, and changes in condition. Patient safety requires focus and consistency, even during 11. Why do you want to work at this hospital? I want to work at this hospital because I am looking for a professional healthcare environment where patient care, teamwork, and continuous learning are valued. I believe your organization would allow me to use my nursing skills while continuing to grow as a healthcare professional. I am interested in being part of a team that focuses on quality care and patient safety. I would be proud to contribute my dedication, compassion, and strong work ethic to your nursing department. 11. Why do you want to work at this hospital? I want to work at this hospital because I am looking for a professional healthcare environment where patient care, teamwork, and continuous learning are valued. I believe your organization would allow me to use my nursing skills while continuing to grow as a healthcare professional. I am interested in being part of a team that focuses on quality care and patient safety. I would be proud to contribute my dedication, compassion, and strong work ethic to your nursing department. 12. How do you manage your time during a busy shift? During a busy shift, I manage my time by staying organized and prioritizing tasks based on patient needs. I review assignments, identify urgent responsibilities, and plan my workflow while remaining flexible for emergencies. I try to complete documentation on time and communicate with the team if priorities change. I also avoid delaying important tasks such as medications, assessments, and patient updates. Good time management helps me reduce stress, avoid mistakes, and provide consistent care to all patients. 14. How do you protect patient confidentiality? I protect patient confidentiality by following privacy policies and only discussing patient information with authorized healthcare team members. I avoid talking about patients in public areas, sharing details with unauthorized people, or leaving records where others can see them. I also make sure electronic records are accessed only when needed for patient care. Confidentiality is a key part of trust in nursing. Patients must feel safe knowing that their personal and medical information is handled respectfully. 15. Where do you see yourself in 5 years? In 5 years, I see myself becoming a more skilled, confident, and experienced nurse. I want to continue improving my clinical knowledge, communication, and leadership skills. I am interested in gaining experience in patient care and possibly specializing in an area where I can make a strong impact. My goal is to keep learning, support my team, and provide high-quality care to patients. I want to grow with an organization that values professionalism and patient safety. Nursing interviews are designed to test more than clinical knowledge. Employers want to see whether you are compassionate, responsible, calm under pressure, and committed to patient safety. When answering nursing interview questions, always connect your response to real nursing values, such as teamwork, communication, accuracy, confidentiality, and care quality. Avoid giving short or generic answers. Instead, explain how you think, how you act, and how you protect patients.